Good evening and welcome to the Red Cross of Georgia Forum on Sickle Cell Disease. My name is Maria Center and I'm the Executive Director of the Southeast Georgia chapter based in beautiful Savannah, Georgia. We're so happy you're with us this evening and we have a great program in store for you. And we're going to get right into it, but before we do, I'd like to thank the Sickle Cell Foundation of Georgia and Dr. Milford Green, co-hosts of this evening's program. I would also like to thank our host committee. And Tia is going to put a slide up there. There we go, Tia, thank you. These are the members of our host committee, elected officials from throughout the state of Georgia. We thank them for serving on the host committee and we thank them for their support. Please put your comments and questions in the chat and we will address your questions a little bit later in the program, and we will also have a question and answer period, and we would love to hear from you. And now, without further ado, I'd like to introduce the Chief Executive Officer of the American Red Cross Georgia region, Dee Dixon. Take it away, Dee.
Thank you, Maria, and thank all of you for coming out tonight. We want to thank our elected officials, our government partners, volunteers, board members, blood partners, and any financial donors that are out there. And as the saying goes, it takes a village to deliver our life-saving mission, and we could not do it without you. I appreciate everyone taking the time to join us this evening, and we're so glad that you're here to learn a little bit more about the American Red Cross Blood Saves Lives Sickle Cell Initiative. I want to introduce our next speaker, Senator Raffael Warnock.
Hello, Georgia. I want to offer my thanks to the American Red Cross and the Sickle Cell Foundation of Georgia for inviting me to help welcome you to today's virtual Sickle Cell Forum. This is such an important conversation, and one that I'm glad to see happening now as we are all working to move past this pandemic and get back to the new normal. I'm thrilled to see the Red Cross continuing to lead the effort to encourage donors of all races and ethnicities to give blood, and to ensure Georgians and people around the country who are in need of blood can get the blood they need where and when they need it. This is so critical for healthcare in our country, but especially for patients with sickle cell disease, many of whom are Black. We know sickle cell disease, the most common inherited blood disorder in the country, affects over 100,000 people here in the U.S., including a disproportionate percentage of Black people. And we know Georgia has the nation's fourth highest number of individuals with sickle cell disease. We also know that blood transfusion is an essential treatment for those with sickle cell disease, and that blood donations from individuals of the same ethnicity and blood type have a unique ability to help patients fighting sickle cell disease. That makes blood donations from Black individuals crucial for helping care for patients with sickle cell disease and supporting the health of our communities. And that's the reason I'm so proud to stand with partners like the American Red Cross, the Sickle Cell Disease Association of America, and the Sickle Cell Foundation of Georgia, who have been leading the charge to enhance awareness about sickle cell disease and to encourage blood donation. Every 2 seconds, someone in our country needs blood and or platelets, but supply cannot always meet demand because only about 3% of people donate blood yearly. And even beyond sickle cell disease, since more than half of Americans, African Americans, have type O blood, the most needed blood type, we are particularly critical in helping meet the constant need for blood, as well as helping our brothers and sisters navigating sickle cell, especially coming out of the pandemic. So let's all keep doing our part. Thanks for participating in this worthwhile discussion. Know that you will always have a partner in me. And if you can, make a life-saving blood donation today by calling 1-800-RED-CROSS or visiting redcrossblood.org. Keep the faith and keep looking up.
Our thanks to the Reverend Senator Raffael Warnock for taking the time to create this message for our program. We really appreciate his support. And now I have the great honor of introducing Dr. Baia Lasky, Medical Director for Biomedical Services, Georgia's Red Cross. Dr. Lasky received her medical training at the University of Illinois at Chicago and completed her fellowship in blood banking and transfusion medicine at UCLA. Her career interests include sickle cell disease, platelet transfusion practices and product development, inventory stewardship, and pediatric transfusion medicine. Welcome, Dr. Lasky.
Hi there. I'm having trouble getting on the video. So I just wanted to thank everybody today for joining us. There we are. Hi. Thanks so much, everyone, for joining us today. Thank you, Maria and Dee, for arranging this, and to everyone in our audience today who's joining us to learn more about this most important issue of sickle cell disease and the role of the Red Cross and how we can support them, and why this is an important issue, not only in medicine, but to the community that we are all living in, a part of, and serving. Next slide, please. So just to touch on this briefly, we know that there are health inequities in diverse Americans. You can see this graph showing the life expectancy. In gray is representing all races. In blue, we see the white or Caucasian population, and in green, we see the Black or African-American population, which is quite reduced relative to the standard population. And really, this is not okay. Sickle cell disease is one of the diseases that definitely impacts life expectancy, although we know it's multifactorial. But this is one way that we can start trying to address these inequities. And this really speaks to the diversity of people and their genetics. And this is not a foreign concept. If you know anyone or are familiar with the concept of getting an organ transplant, you know that it needs to be matched, whatever that means, right? So a match means that in some way it will not produce a rejection. Well, a blood transfusion is very similar in that it is a transplant and it needs to be matched. And the more we have come to understand about genetics and blood features, the more we realize genetics are actually important to this. Next slide, please. So just a little bit about what sickle cell disease is. It derives from a single mutation in the DNA strand. And what happens is your red blood cells, which are responsible for carrying oxygen, are normally disc-shaped, like you see in the top picture. And the mutation causes the hemoglobin to misshape and the cells become this sickle shape. And that's why it's called sickle cell disease. It was formerly known as sickle cell anemia, but the disease goes far beyond just having low hemoglobin in your blood. And so what happens with the sickled cells is they get jammed up in the blood vessels. And so you, I'm sure, know that all of our bodies need oxygen. Every organ and every tissue needs oxygen to function and to live. And with decreased oxygen flow, with decreased blood flow, it starts to impair the function. It functions less optimally. And if this is prolonged, the tissue can actually die. So the sickle cell disease, when you start having these occlusions in the blood vessels, it's impairing blood flow and oxygen to all organs and tissues. Next slide. So sickle cell disease can manifest throughout the body. It can cause stroke, and we often see this as one of the most common reasons for stroke in children, even in infants sometimes. It can impair the eyes, it affects the lungs. They're very prone to lung infections, lung disease. It can cause heart failure. It can cause liver disease, gallstones. They have to have their gallbladder removed. It causes a number of different types of metabolic derangements. It causes kidney failure. It causes the tissues in the bone to die, which is called avascular necrosis, which can lead to infections in the bone and also requiring bone like joint replacements, even in young people. It can impair the spleen, requiring removal of the spleen, which also makes the patients more prone to infections. They can have complications of pregnancy, skin ulcers, and chronic pain. And chronic pain is actually very important to recognize and understand. It's one of the most common presenting features for patients with sickle cell disease when they present to the emergency room. And this is not only just they're experiencing severe pain that is intractable to pain medication, but they are often perceived as being drug seeking, and they're not getting the care that they need, even just up front. So there's a lot of education we need across the board in understanding this disease. The symptoms typically show in infancy. It varies in severity from person to person, but it worsens over time. And the life expectancy is about 45 years. Next slide, please. As you heard Senator Warnock say, it is the most common inherited blood disease in the United States. It affects about 1 in every 365 Black or African American births, and it affects about 100,000 Americans. And because it's an inherited disease, it can be passed from parents to children. Next slide, please. So this was a heat map of the US Census from 2010 showing the African American population in the United States. And you can see the predominance in the southeastern states. So this is us, this is our community, this is our family, our friends, our constituents, our patients, and the people that we have to look after. So this is why we are here today and why it's particularly important to this community. Next slide, please. So the mainstay therapy for sickle cell disease is blood transfusion, and that can take shape in a number of ways. We can do what's called a simple transfusion, where we transfuse 1 to 2 units, and that's usually used in situations where the patient is having what we call an acute crisis, where, so I explained the sickled shape of the red cells. Not only does this cause blood cells to jam up, to log jam in the blood vessels, but it also makes the red cells have increased fragility, so they break. So in the middle of a crisis, they can have a very, very precipitously low hemoglobin, where they just need to increase their hemoglobin so they have oxygen coming to their tissues. Or we can also do what's called an exchange transfusion, which, depending on the size of the person and a number of other factors, we would require 3 to 10 units to do the exchange, where we're actually, the patient is hooked up to an instrument and we're removing their sickled cells and we are replacing their blood with the donated blood. And this is used to keep the sickled the proportion of the sickled cells low, and to prevent sequelae of the disease, such as stroke. So the annual consumption for a patient can be anywhere between 36 and over 120 units per patient. So a hospital with a sickle cell disease program with only 10 patients will consume in the range of 360 to upwards of 1,200 or more units per year. Next slide, please. So why do we need diversity in the blood supply? We need it to meet the needs of to transfuse patients like those with sickle cell disease. They are specialty patients who need special blood. We need diversity in the blood supply to limit red cell protein exposure and antibody formation, and I will talk about that a little bit more in a minute. And generally, the closest red cell match for a patient that requires frequent transfusions comes from donors from same or similar ethnic or genetic backgrounds. Next slide, please. So just to illustrate this, if we have an African-American patient with sickle cell disease and they have these features, so I like to say that red cells are like faces, they're all different. And so they have certain features that we have to try to match, and the better we can match them, the better for the patient. So if we screen 250 units of blood from Caucasian donors, next slide. we may find one unit that is compatible for this patient with these features. Next slide. If we screen 250 units from African American and Black donors, we may find 28 units. So we have up to a 28-fold better chance of finding compatible units for these patients. Next slide. So this shows that from 2019 US Census data showing that Black and African Americans comprise 13.4% of the national population. Next slide. This shows over on the left is the population of African Americans in the American Red Cross donor database, or the donor population. You can see that's between 4 and 5%. So that means that they are not represented appropriately or proportionately in our donor database. And so we really need to, we're working on making up this discrepancy. Next slide. So what happens when we can't find matched blood, as is often the case? Number one, either patients will not get transfused. We just don't have the blood, which means they're getting delayed care. And that's, we're not giving them the care that they need and the care that's appropriate for their disease and that's outlined in the literature, in the medical literature. Or they will get transfused with mismatched blood. And both of those have serious consequences. Next slide. So a mismatch will lead to antibody formation. So similar to when your body sees a pathogen like a bacteria or a virus, if it's something foreign to the body, your body will make an antibody against it. And that's an appropriate immune response. Well, when you start to see many blood transfusions with red cells that have features that are different than your own, you start to form antibodies against them. So you have patient red cells, the proteins on the surface are called antigens, and those look different than the donor red cells. And the patient will perceive this, the patient's body will perceive this as foreign, make the antibodies, and a number of things will start to happen. First of all, it will target the donated cells, so it'll start to destroy them. Not only is that just completely defeating the purpose, you're not making any gains with the blood transfusion, but it can actually do a number of things. It can cause something that's called hyperhemolysis, which actually triggers widespread destruction of all of the red cells, including the patient's red cells, so they end up even worse than when they started. And then these have downstream consequences. You have all of these red cells breaking, spilling their contents into the bloodstream. This can cause widespread whole body coagulation, where the whole body is clotting and bleeding at the same time, which can be fatal. It can also cause kidney failure. So this is the importance of finding compatible blood. Next slide, please. So you can see here the Red Cross transfusion support for sickle cell disease going back to pre-COVID, September of 2019. In fiscal year 2019, we distributed about 96,000 specialty units. And 47% of those units were coming from African-American donors. And you can see the red arrow there. When COVID hit, our number of African-American donors dropped precipitously, and our specialty inventory depleted by 63%. And what this resulted in was around the country, and we were particularly impacted here in Georgia, is that we just didn't have enough blood to treat patients with sickle cell disease. We either had to reduce the number of units that they were receiving, or reduce the frequency of their transfusions, and really, again, not getting the care that they need. Next slide. So we're doing a lot right now. The Red Cross has huge efforts across the country and regionally to close the sickle cell gap. We are partnering with communities. We started out early this year partnering with historically Black colleges and universities. We're actually in the middle of a 16-day challenge right now that started on June 3rd, which was Dr. Charles Drew's birthday, and it ends on June 19th, which is Juneteenth, and also World Sickle Cell Day. That's challenging HBCUs to partner with us to get people to pledge to donate blood. We also work with faith-based organizations and other organizations such as Sickle Cell Foundation of Georgia. We're very grateful for their partnership, and anyone else that really wants to partner with us and get on board to help spread the message. We are also hiring sickle cell account managers to help support diverse blood collections. We are enhancing our donor selection process and blood testing to identify compatible blood. And we are partnering with the American Rare Donor Program. This is not new. This is something we have always done. But this facilitates both national, between different states of the Red Cross, as well as between different organizations where we are sharing rare blood to support these patients. Next slide. So how can you help? First of all, become a blood donor. As Senator Warnock said, only about 4% of the population donates, but about 40% are eligible. So there are a lot of people out there that can donate and could be donating. You could host a blood drive, help recruit donors, encourage blood donation, volunteer to be a blood ambassador or influencer, request a presentation. We're always happy to come meet you at least virtually right now or in person if the circumstances allow, to do education like this, spread the messaging, support our educational efforts, and invest in our mission. Next slide, please. And just final takeaways, what you need to know about sickle cell disease is that patients with this disease are transfusion dependent for the entirety of their life. We are not meeting the needs of our patients. Failure to treat them appropriately has serious consequences, including a decreased life expectancy. Patients are dependent on specific individual donors who are genetically similar, and we really need people who will become lifelong donors. And we would love to see the culture of blood donation grow in this community. And thank you so much for your time. And next slide. I went through a lot of information, rapid fire, so please, if you have any more questions, you can email me directly. Thank you again.
Thank you, Dr. Lasky. You do a brilliant job explaining the science behind sickle cell and explaining why this is such an urgent issue. Thank you so much. And now it gives me pleasure to introduce Jaleesa Turner. Jaleesa hails from Athens, Alabama, and was diagnosed with sickle cell when she was 7 months old. Jaleesa works with Red Cross to educate the public about the urgent need for a diverse blood supply to support people who have sickle cell. Jaleesa received the Unsung Hero Award and a scholarship for college by the MTM Corporation. She attends Calhoun Community College and one day hopes to get her doctorate to become a nurse practitioner to work with people who have sickle cell disease. Jaleesa is a Red Cross volunteer and serves as a blood ambassador. Jaleesa, welcome.
Thank you so much. Hi, good evening, everyone. Good evening, everyone. My name is Jaleesa Turner, and I am 25 years old, and I have sickle cell disease, and I was diagnosed at 7 months old. I have had over 100 blood transfusions in my life. And I developed antibodies in my blood to now where it comes to me getting a blood transfusion, there's only 8 donors who match my blood that I'm allowed to receive blood from. I just want to say that it's very important for African Americans especially to donate blood for people like me and others with sickle cell, because of the fact that, you know, our blood, it matches, it has the same antibodies, whereas I get blood from, I used to get blood from all types of people and it didn't match. So it didn't match my blood. So I would have reactions to this and it's very horrible, honestly. I wouldn't wish it on anyone. And I just ask you to please help when you can. Please donate blood. I volunteer with American Red Cross, And I try to get more and more people to donate blood because it's very important. And, you know, it's very hard for me to continue on with life because of the fact that I can't work. But even though I do volunteer with American Red Cross, I get a lot of experience so that whenever I do start working and I'm able to get a job, I will have the experience to be able to work in the world. I want to become a nurse and help those with sickle cell who are sick. And people with sickle cell go into the hospital and, you know, they're treated very badly because of the fact, one, they're African American, and two, they're looked at as drug seekers. Sickle cell disease is a very painful disease, and we have to have a lot of pain medication to be able to, you know, at least relieve us from our pain. I have been looked at as a drug seeker many times. It's very hard and it's heartbreaking to the fact that just because of the color of my skin, I can't get the fair help and appropriate help that I need to be able to fight my disease. I have suffered from acute chest syndrome. I've had a hip replacement when I was 16 years old due to osteonecrosis. And I've had pneumonia countless times. I believe I've had pneumonia over 100 times. And being in the hospital for so long and having to worry about if I'm going to be treated fairly, because I've experienced a doctor telling me that they didn't believe I was in as much pain as I said I was. They believed that I was there for the drugs and nothing else. And so it's very hard for a person with sickle cell to be treated at many hospitals. And so I ask that it's very important, and I ask you to please donate as much as you can, encourage others to donate, because we really do have a shortage and we really need people to donate blood. I would like to thank American Red Cross and thank everyone here who is watching because we really appreciate your support. And we couldn't do this without your support. So I thank you, American Red Cross, and thank everybody for allowing me to be here to speak today.
Jaleesa, thank you so much for sharing your story with us. You're such a brave person and you're such an inspiration to all of us. I heard Chloe in the background barking.
I'm sorry.
I think Chloe thought you were doing a great job, and you did. Thank you so much, Jaleesa.
Thank you.
And now it gives me pleasure to introduce Shivan Gandia Lonan. Shivan is the mother of 13-year-old Jay, who was diagnosed with sickle cell disease when he was 8 months old. Shivan is a teacher in the McIntosh County school system, and she teaches at Todd Grant Elementary in Darien. She has worked in many roles, including working with gifted kids, and is currently working with children performing below grade level. She has served as a mentor teacher, a lead teacher, and a mentor teacher at the College of Coastal Georgia in Brunswick. Shivan has an undergraduate degree from Georgia Southern University and a master's in education from Armstrong Atlantic State University. She lives in Hinesville with Jay and his little brother, CJ. Welcome, Shivan.
Thank you. Hi, how's everybody doing? I hope you're doing well. As Maria told you, I do live in Liberty County, but I teach in McIntosh County. I'm very fortunate that my son with sickle cell disease is able to attend a school that understands and works with his illness. I am blessed to work in a school community that supports me and understands the struggles I go through and my child goes through as we live day by day with sickle cell disease. Currently, my son, he takes hydroxyurea, which is 250 milligrams daily to reduce the likelihood of sickle cell pain crisis, 1 milligram of folic acid to help him make red blood cells, 1,500 milligrams for Oxbryta to stop the cells from sickling. Now, because I have private insurance, the average retail cost for this medicine is over $21,000, and that's like per month. But with my insurance, it's $125, but that's per month as well. So we have this pharmacy that's with CVS that's out of California that actually sponsors us for free. He takes a multivitamin, a fish oil, and he also it's also another medicine called Endari, but that costs $150 a month. So I'm not able to get that one because I also have his PRN medicine, which are Motrin, morphine, hydrocodone, and Toradol. He takes a total of 11 pills daily, but since I have private insurance, but if I was able to get like Medicare or anything, he'll have like 7 pills a day. If he's on like in a pain crisis, he can take up to 20 pills a day. But sickle cell, not only does he, we have to work with his pills, but it also affects all aspects of life, even the decisions that I make for him to attend school or to live, like you could say, a quote unquote, a normal life. When Jay starts a new grade, I have to educate the teachers about sickle cell, and so he won't go into a pain crisis. When we're planning for events, whether they're indoor or outdoor, I have to make sure and think about the temperature extreme, make sure it's not too hot or too cold, make sure he has a place to rest or he can cool off with warm fluids. With cool fluids, or if it's cold with warm fluids and extra clothes. When we're traveling or going on vacations or doctor's appointments out of town, I have to factor in the restroom break for Jay because of course he has to drink more fluids than the average person to make sure to keep him well hydrated. Contact sports such as football, of course, everybody wants to play, but for Jay, I think about him getting hit too hard or in the wrong place and being placed in the hospital for an extended period of time. Even down to my job choice. I've been with my job for going on 17 years, and they are very flexible and understanding. At times I have to leave immediately for work and I won't return, let's say for a week or so. I remember one time within a year, I had like over 50 absences. So it's very difficult. You run out of sick leaves and then that's a strain on you as well because you have to pay for all of the medicine, the co-insurance, the deductibles. Also during the hospital visits, you go in through the ER first and the doctors at the ER, they do attempt to try to stop and control the pain. But if they can't, he's admitted to the hospital in the special care unit for the pediatric side. And then they start putting him on a pain pump to try to control the pain and pushing lots of fluids to push those sickling cells. Now, if after a day, if he's still not moving, pneumonia can set in. And of course, to combat that illness, if he has that, like Jaleesa, where she said she had it over 100 times, you have to do x-rays and blood tests and antibiotics and respiratory therapy. Also, if he's on that pain pump with morphine, it lowers your your O2, and you also, because you have those fluids coming in, it dilutes your blood. So he's on oxygen, and with the morphine, sometimes he has allergic reaction, so he has to get nausea meds through the IV as well. And then they start working on it, the blood count. And that's when they start looking at transfusions. You have to make sure that you have extended typing. You have to make sure it's like a guessing game. They look at his baseline, where he's at right now, and they try to get him up where he's usually at. And if he has an infection, of course, that takes time. And they said that breaks down the blood cells. So then you have to do more transfusions. After they get him pretty stable and he could take medicine by mouth, they send him home. But that doesn't mean that he's out of pain. He still has to take hydrocodone. He may not be able to walk or use his arm, or his back may be down, which was the case this year. He was out of school actually since October 2020 this year because it kept jumping around from his arm, his leg, his shoulder, and his back. So sickle cell pain takes a crisis take a toll on him, Jay, as well as my family and all my support network out there at work and in the community. So he has been hospitalized several times. I remember one time he was in the hospital and they pumped 78 milligrams of morphine in him in a 24-hour period, and he still couldn't get up. He would tell me all he wants to do is sleep because he can't feel the pain that way. Seeing him is like torture. I don't feel it, but I feel help. But I know he's in pain because I'm looking at him. You feel helpless, you start praying, and you start worrying. You start worrying about his future and his health and his life. Will he get tired of fighting? Because he's a warrior, just like Jaleesa's, they're a warrior. Will he give up? How much can his body, his organs take? Just like she said, she had a hip replacement. Will he make it out of time, make it out of the hospital in time? Will he ever have, if you say a quote unquote, a normal life? Then you have to fight the doctors, like you said, because some doctors don't believe that you're in so much pain. Sometimes they want to limit your medicine or limit your meds. And then you also have to fight, and then some doctors, you have to educate them on sickle cell. And then you have to go battle the hospitals as well. And you have to pay all those deductibles and the co-insurance and the out-of-pocket. And then if they want to limit some things too, or if they want to deny things. But anytime, and this was a great time for me. And I really do appreciate you listening, because I wanted to discuss and I wanted to share Jay's story and his struggle, because with American Red Cross, they're able to get blood out there, and blood is the lifeline for many sickle cell warriors. And they are warriors because they're battling to live with this illness day in and day out, and just to do the simple things and to smile. And behind that smile is pain, is doubt, is depression, is uncertainty, because they don't know what will happen. And adding on to this, all this is going on in their mind, is they're worrying about the limited blood supply. That shouldn't be on the list. So we do need more donors, and we need more support, and we need voices out there to move mountains for these warriors, and then help them to have a normal, or to close to, as we say, quote unquote, normal life. So each and every one of you, I want you to use your voice to spread the importance of sickle cell awareness to everybody, anybody, to all the doctors and nurses and insurance company and lawmakers, because change starts with one person. As you close your eyes, I want you to imagine your child or grandchild fighting for life. Wouldn't you do anything to save them? So I do appreciate everybody, and I wish you well. Thank you.
Thank you, Shivan, for sharing your story, and from the perspective of a mom, and the realities of caring for a child who has sickle cell, and how this disease has impacted your family. Talking to you over the past several days, talking to Jaleesa, has been very eye-opening for me, as I'm sure it has for many people on this call tonight. And you're both getting a lot of love in the chat right now. So just look at those beautiful sentiments that we see right now, and you've touched so many hearts. So thank you both for speaking. And now I'd like to turn it back over to our CEO, Dee Dixon.
Thank you, Maria, and thank you, Jaleesa and Shivan. This is my second time hearing from Jaleesa, and can you imagine just being a teenager getting the hip replacement? I can't. Shivan, I'm a mother of two, and I know there are other parents out there. And when you shared Jay's story, I mean, we stand with you. And if the only thing that we have to do is give blood, not one, but two, but however many times that it takes, and or tell someone to give blood, we're doing that. So thank you both for sharing the story and your journey this evening. And now it is time to take action. And how do you do that? Dr. Lasky mentioned some of this earlier tonight, but using your platform as a public official to amplify sickle cell awareness and promote blood drives in the Black community. Activate your network. Social media graphics is definitely a key. The graphics and the messaging to spread the word, to donate Black blood. There's a hashtag, Black blood donors needed. Spread the word. And lastly, if you're interested in organizing or promoting a blood drive, is Paul Daniel on the call? Paul, can you come on and share with the audience how they can do that as far as organizing and promoting a blood drive?
Hi, Dee. Hi, everyone. Yes, sure can. My name is Paul Daniel, and I'm the district manager for recruitment for the Atlanta Metro West American Red Cross. And tonight, if some of the things that you've heard have moved you or have led you to a call of action, and you're interested in hosting a sickle cell blood drive with the American Red Cross, you can simply just email me at paul.daniel2@redcross.org, and I'll connect you with one of our 3 sickle cell account managers, Latasha Tate and Mel Harris, who both cover the Atlanta Metro and Georgia North area, or Mariah Carter, who covers the Georgia South and Georgia Coastal area. Our sickle cell account managers specialize in helping you develop a successful plan for a successful sickle cell blood drive. And thanks again for your willingness to help in any way by either hosting a drive or becoming a blood donor yourself. If you'd like more information, just contact me, paul.daniel and the number 2@redcross.org, and I'll connect you with either Latasha, Mel, or Mariah for more information. Thanks and have a great evening.
Thank you, Paul. And I can't wait to hear from the team to see if they get some emails from our family out there listening. So now it's time for some Q&A. So Maria, you were mentioning that the chat was filling up. Do we have any questions in the chat?
Dee, I didn't see any questions. I just saw a lot of wonderful comments about our speakers. So I think we can go straight to the Q&A if you want to take that.
Yes. All right. So most of you are on mute, but if you have any questions for our speakers this evening, please come off mute and come on camera to ask your question, and then mute and off camera again. Do we have any questions there?
If you would like, you can raise your hand using the reactions feature on Zoom. There's a raise hand function, and then we'll choose you to get started.
Thank you, Tia. Anything for Dr. Lasky?
Dee.
Yes, okay.
Dee, if I may, Smythe Fallen, say congratulations to you.
Thank you.
And you were introduced earlier, but to the brothers and sisters in leadership, this is the new CEO of the Georgia region, Smythe Fallen.
Thank you, Smythe.
Hello.
Yes, we hear you.
Hi, I'm Sarah Hayes. I'm the Mayor Pro Tem for the city of Walterville. And I commend everyone for this because it's very much needed. But my question is, this is the first time that I've seen this. Is there other information that we can use to get out to our citizens? And how do we come to that information?
Well, I will start and I'll let Maria and Dr. Lasky kind of chime in. This is our 3rd series of 4 as far as our sickle cell awareness forum. We started in February with our HBCUs and Black History Month. And we had recently our faith-based community just a few weeks ago. And now we have our elected officials. In a couple of months, in August, we're also going to have a general public update regarding sickle cell awareness. How do you get the information? 1, we're going to have a video of this. We recorded it tonight. And 2, I think each of you were invited by somebody. If that was a executive director or a account manager on the biomed side, they have information that they can give you. And then 3, just call, I guess you can go to our redcross.org /blood, and that would get you more information as well. So a few ways that you can get more information. Does that help?
Definitely. Thank you very much. That was a wealth of information on this video, and we definitely appreciate you. Thank you so much for everything you're doing.
Very good. And thank you for joining us this evening.
Sarah, we'll be reaching out to everyone who is registered, and we will be sending you additional information. And I see that my friend Tanya Milton has her hand up. She works for the Savannah Tribune, and I know you have a big platform, so you can really help, Tanya.
Tanya, you're on mute. If you can unmute yourself.
Sorry. This is a very great program. And what you're doing is phenomenal. So I'd like to help with getting information out to my constituents. And also I'm happy to do your press releases and everything in the newspaper, but I do have a huge district. I am the county commissioner in 5th District of Chatham County. And I would love to be able to put some information in some of my constituents' hands. So Maria, if we can get together to pick up information, I'll be happy to do that.
Thank you, Tanya. Really appreciate that. We'll be in touch.
You guys are already activating our call to action. So more, give us more. Anyone else?
Looks like we have another raised hand. Shari Barr. Shari, you on mute?
Thank you. Yes, I'm stopping video, but I'm not seeing myself.
We see you.
We see you.
Okay, good. I'm glad you can see me anyway. I just wasn't sure if I was on camera or could be heard. My name is Sherry Barr. Maria, thanks for sending me the link and the invitation. I serve on City Council in Statesboro, Georgia, and learned some things I didn't know tonight. And particularly how specific this is to our part of the world, our part of the country. And so I am happy to do what I can to share information. And I'm sure I'll be hearing more from Maria, and I'm happy to try to get that out to folks here in Statesboro. Thank you for the program tonight.
Thank you, Sherry.
Maria, you're going to be busy.
Hey, Southeast Georgia representing. I'm very happy.
I like it.
Yay.
Any other comments or questions out there? We have a few more minutes.
Looks like Lee Davis has her hand raised.
Yes. Hi, I'm Leah Davis, and I am happy to be here tonight for this wonderful program to bring awareness to sickle cell, as well as to bring awareness for blood donations that are greatly needed. I bring you greetings on behalf of Commissioner Lorraine Cochran Johnson of Super District 7 in DeKalb County. And I would like to just speak very briefly on how we have been working with the American Red Cross in DeKalb County to bring awareness to sickle cell, as well as to raise awareness about blood drives and to get more African Americans to donate blood. So the commissioner has sent out close to 100 letters to churches throughout the district, asking them to host blood drives and congregants to also give blood. And also we are partnering with the Be the Match Foundation, and they are having a drive-through event on July 17th, where they will have a swab and go. And that is to assist people who can maybe qualify to be to be donors for people who actually have sickle cell disease and other blood diseases. And so the American Red Cross in DeKalb County will be partnering with us on that event as well. And so I just want to again say thank you for inviting District 7 to this event tonight. I would like to give a special thank you to Mr. Jay Lawrence, to Mr. Samantha Fallon, to Mel Harris, Ms. Mel Harris, and also Mrs. Latasha Tate. Thank you.
Excellent. And thank you for sharing that.
You're welcome.
Yes, I mean, because you just made it come to life that the partnership is there. So we really appreciate that.
Absolutely, absolutely. And the commissioner is committed to doing everything that she can to assist in this initiative.
Yes, thank you.
Dee, Jaleesa wrote in the chat, does anyone have any questions for her? Don't be shy.
I wanted to ask Jaleesa, like, is she able to go to school full time? I was just thinking about that when she was talking about her scholarship and her goals to be a nurse. Are you able to go full time to college, Jaleesa?
Well, honestly, not really, because it's just a lot on me. So I just try to go to school part-time. And I was talking to my doctor yesterday, and she told me that I can go ahead and sign up for nursing school. And I was waiting on that because of the fact that I'm supposed to have a bone marrow transplant to cure my sickle cell. And I was gonna wait until after that. But she said it was okay if I did it. So I'm gonna try to push myself to be able to go to nursing school full time. So wish me luck.
Best of luck to you for that. And you keep us posted. And you keep us posted.
I will.
She's in my text now, Dee. We're sending each other pictures of each other's dogs. Cornbread said hello to Chloe last night.
Okay.
I'm walking Chloe right now. That's why I'm outside.
Thanks, Jaleesa. I see that we have thank you, dear. Brenda Waltower has her hand up. Brenda?
Hi, I'm Brenda Waltower from Liberty County. And I just want to say thank God for the invite, to this virtual sickle cell meeting on tonight. And it's very touching, just to hear about our warriors. And I would like to, try to do my best to get out there more, to let social media and everyone else know about donating blood. And also, how can I get like a copy of the letter where I can like take it to the churches for the host like a blood drive?
Brenda, we're going to be reaching out to you since you registered for this, so we will definitely be in touch. And it's so exciting to see people here from Liberty County, people with Tapestry connections. Donald Lovett is on this call. Just really proud of Southeast Georgia, y'all.
Yes, ma'am. Thank you so much.
We'll be in touch. Thank you.
Thank you.
Before we go, Maria, and I may be putting her on the spot. Is Adrienne Alberts still on the call? She's from our headquarters. Okay, she was on earlier, and I see Dr. Green. So, and I don't know if he's going to be closing out. I just see some friends out there. So I will turn it back over to you to make sure I'm not overstepping, because I see friends out there and I want to say hello and want them to say hello.
No, I think we're good, Dee.
Okay.
We will definitely be reaching out to everyone who attended tonight. We want to thank you for your participation, for your interest in this critical issue. And I don't really have anything further. If anyone else has any questions or comments, we really appreciate your participation this evening. And thanks to Dr. Lasky, to Jaleesa, and to Shivan for being our speakers.
And let me
Thank
just
you.
say one other thing before I say a thank you. We are going to have one more session in August, and it will be for our general public. It will be for our businesses, our United Ways, individuals, families. So stay tuned. If you got an invitation from a Red Cross partner, more to come, that you can join us again and learn a little bit more. More to come in August as we continue with this focus on diverse blood, sickle cell disease. So I, like Maria and the rest of the Red Cross family, want to say thank you so much for joining us this evening. I do hope you got something out of it, and it seems like you did. And stay tuned, more information is coming. So thank you so much, and thank you for making a difference. Have a good night.
Thank you. Good night.
Thank you.